Welcome back. It's time for Your Health, our focus of discussion, the latest statistics that have been released by the National AIDS Control Council, that is the Kenya AIDS Response Progress Report of 2018, indicated that overall HIV and AIDS new infections have gone down. But really, what is happening? Are there some statistics that we should be concerned about, particularly among young people? What are the prevalence rates? Let's just get a bit of the statistics before I talk to Joshua Gitonga, who is the head for monitoring and evaluation at the National AIDS Control Council. Please run those statistics for us. Well, that is just a summary of what is contained in this particular report, but let's get to understand what those numbers mean and what really should be looking out for, particularly as we move towards marking the World AIDS Day on Saturday. Joshua, thank you for joining us this evening.
Thank you, Catherine.
We're talking about the rate of HIV, new infections generally going down, but do we have something to celebrate as we move towards the World AIDS Day?
Yes, for sure we have. Because looking at what is contained in the report and compared to the previous years, we've seen that across all the age cohorts or categories, the new infections are going down. And I think this is a positive thing for the country. After all the interventions that have been done, I think it's something that really we can say, yes, we have been able to take steps. We have been able to progress. But the question remains is, are we there? So I think that's where we are, but we need to move further and ensure that we reach the targets that we have given ourselves. That is new zero infections in the country.
Did you meet your targets? Perhaps, you know, if you compare with 2017 and 2018, perhaps you would say that you want to ensure new infections are at this point. Is that where you reached, or did you fall below your targets?
Definitely we fell below our targets. But the good thing is that continuously, especially, let me pick like new HIV infections within the country, we've seen that there is a trend which is kind of showing us that really we are reducing the number of people who are getting infected every year. Now, about this report, this is the third report that we are producing as a country through National AIDS Control Council, which is in the Ministry of Health. And the purpose is really to assess across, in line with our strategic plan that we have for the country. We ask ourselves, then how are we doing? Because we planned, we have implemented, where are we? Therefore, the Kenya AIDS Response Progress Report targets now to provide that clear picture of where we've done well, where we've not done well, so that at least this becomes a feedback to everybody, to all the stakeholders within the HIV program, so that they can be able really to replan and chart our way forward. Yes.
But even as you know, we celebrate some of the progress that we have made. We are a bit concerned about your statistics. 15 to 24-year-olds,
yes,
they are the highest new infections that have been reported.
Yes.
What is happening? 15 years.
Yes, looking at them, these are people who are in school, and mostly high school and tertiary institutions. That is true. But really quite a number of things that we consider when we think of the young people. One of the things is that the question that comes in is, have we empowered them enough with comprehensive knowledge on how to prevent HIV and AIDS? From the report that we have, even the Kenya Demographic Health Survey showed us that we are not there. When you ask young people what is HIV, all of them will know. They'll tell you, yes, it's a disease, we know it. But when you look at comprehensive knowledge on how to prevent HIV, how it is transmitted, then you realize there are very few who have the factual information that can empower them to make that decision, which is important to prevent HIV. So that's one. Number two, we have stigma. Among young people, stigma is quite high. And this has also contributed in terms of young people coming out, especially them that are living with HIV. It's also noticed for them. And I think it's just because of the stigma that is coming from the surrounding, those people surround them, where they are dwelling, where they are staying. There's a lot of stigma, and this has also been seen to affect. Of course, the other thing is when we look at education, we know that mostly when you retain young people in school, then this delays their sexual debut. And basically this helps to ensure that really they don't engage early, and basically then, of course, that way they're able to prevent. Quite a number of things that we see coming into play for the young people. And of course, what most people talk about when it comes to economic reasons. Yes.
Poverty.
Poverty. And of course, trying to be, I mean, in step with what is happening in terms of fashion and everything.
Yes. The Catholic Church, the Catholic bishops talked about, immorality, and they were also very concerned about what we are seeing within our young people. Do you think this is also one of the factors, the intergenerational, relationships and those kind of things that are playing out in why we are seeing an increase in new infections among this population?
For sure, when we look at also the information that we have, surprisingly, or half of youth are abstaining. And I think this goes to what the church and the religion within the country is doing. We have almost half of the young people who are abstaining. But of course, we have the other half that is kind of active. And when we look at those then, that is possibly whereby we start the discussion around really the morals and issues within the society that have kind of pushed or led them towards that direction.
What are the numbers? Do you have the numbers when we talk about the new infections among 15 to 24-year-olds?
Yes. When we think of 15 to 24 years, we are thinking around approximately 15,000 around there. So these are the ones that we are thinking of them being infected. It's always 40% of the total number of people living with HIV among the adults. So actually when you look at 40% of those who are age 15 and above, around 40% of them are the young people. So that gives us a figure that is around there.
In terms of a strategy, perhaps, what do you think would be the best way to reach this particular population?
For them, quite a number of things that have been put in place by the Ministry of Health and also through the National AIDS Control Council. And number one, working with the Ministry of Health, because most of them are in primary, in high school and also tertiary institutions. So they are really, we are trying to reach them out in the schools in terms of empowering them, just ensuring that really they have that comprehensive knowledge, as I said. Number two, they need to know their status. So we also encourage them to test and know their HIV status. The other thing is that them that are really, them that are tested and found to be positive, we have clear guidelines that they need to start treatment. And I think it's starting treatment and adhering to that treatment, though it has also been challenging to the young people, especially them that are in school, and also adhering when there is all that peer pressure around them. Yes.
All right, let's now talk about, the prevalence rates. About 1.5 million people living with HIV and AIDS.
Yes.
In terms of their quality care, are they able to access medication and a quality life and food and all these things that have always been factors for them?
I think one thing that I would want to mention is that we already have evidence that actually people who are living with HIV and who are adhering to treatment are living longer. So at least we have those facts that once you start treatment and you continue, you actually live longer. And I think that is why even the government through the Ministry of Health introduced guidelines last year. And the purpose of those guidelines was to ensure that once you test and find you are positive, then you are starting treatment immediately. Of course, this has really ensured that really, any person living with HIV leads a quality life. Yes, and with the systems, with the facilities, with healthcare providers that we have, it is possible to do that. Yes.
What about the number of deaths that result as a result of HIV-related infections?
Sorry?
What about, in terms of the statistics, the number of people who died as a result of HIV-related complications?
Yes, around 28,000 are the ones that died because of HIV and AIDS. And the reason here is basically those who are already not in treatment, and of course those who are living with HIV and kind of they don't know, because they don't know their status. I think these are some of the factors that are led to that. But what I want to mention is that actually even HIV-related mortality or death has greatly reduced. It actually been on a downward curve within the country. And really this is encouraging for the country. That really, yes, it means that when you know your status, even if it is positive status, there is treatment that can help you live a productive life, a long life. Yes.
All right. One of the factors you have mentioned is that people did not know even that they had HIV and AIDS. So that brings us to the question of what is the status of testing? Are people going out to get tested for HIV and AIDS?
I would say yes, they are going, but we know that really across the country, we still also are around 50%. Still, there are others who are not coming out. That
is very low, 50%.
Yes. So okay. Then that like received a test in the last 12 months, they are almost a half. And I think this is why I would encourage everybody to know their HIV status. Somebody said this way, that each one of us has a HIV status. But the question remains, do you know your HIV status? Because each one of us, it is either negative or positive. But we need to know that status. Every Kenyan, you and me, all of us.
What would you attribute, the lack of interest, if I could say it's lack of interest in knowing their HIV status? What do you attribute it to, perhaps, in your research?
Stigma.
Stigma.
Stigma, stigma, stigma. Because people are afraid, because of the way the society, because of the way their peers, because of their way the community, the public, everybody will take them. So that now somebody is possibly afraid, like in case I go and I test, what will happen? And I think that fear has actually stopped many of them. So for me, I would say it is stigma, and it's something that we need to think, to kind of all of us fight against. So that at least as you can go for any other test, you can be able to test for HIV, to be able to know the status that I said. Each one of us really has a status. It is good for us to know.
I know the ministry has been very keen on self-testing. What is the level of uptake, in terms of people getting self-testing kits to just, go and hide in a corner and know their HIV status without necessarily being seen to go to a medical facility?
Yes, for sure, it is a good initiative, and it was meant to help reach out to more people to know their status. And the uptake has been there. It is peaking very well. There are clear guidelines that have been provided by the Minister of Health on how it should be done. And yes, people are coming out really to start. There is that section that really want to go, get the kit, test themselves, know their status. But the advantage is that once you know your status, you can always go to the health facility and confirm. So in a way, yes, it is helping to reach out really a cohort, a group that possibly would want to know before they come to the facility.
In terms of access, how easily can one access the self-test kits?
You can.
Issues of costing and where to get it.
I would mention possibly two things. Number one, within the health facility, there are free kits. You can go there and get tested, and you know your status. You can also go and buy the kit through the chemists that are there and provision points that are there, and then know the status. So I think
what is the rough estimate of a cost if you go and buy it off the chemist? how much would you pay for a self-test kit?
I believe it should be around 500 or so.
Around 500?
Yeah. Yes.
All right, let's look at going forward.
Yes.
In terms of, as we go to mark the World AIDS Day, what really will you be advocating for in terms of trying to continue bringing these numbers down?
Now, the World AIDS Day globally and also in Kenya this time is around testing, knowing one's HIV status, but more so targeting men. Catherine, for at least women and ladies have come out, but men were still hiding. So one of the key things that we are doing with this World AIDS Day is really to target the men and let the men come out. We know that generally men health-seeking behavior is a bit poor. When we come to also testing, it is evident the same way. So the target here is also to tell men, come out and also know your HIV status. But generally, everybody is really being requested to know their HIV status. And I think one good thing that we can be able to do is at least to take a test and know our HIV status as we commemorate the World AIDS Day. Therefore, it will become the World AIDS Day this year will be commemorated in all the 47 counties across the country. Yes.
So what will be happening? Will you be putting kits there so that we can go and get tested, or is there a campaign towards testing that is going to be happening on the same day?
Yes. One, as it is, the county leadership will lead the process in various counties. Number two, testing will be there. There will be opportunity also for us to launch the progress that we've made at the county level. So the report that we're discussing here is at national level.
Yes.
But also during the World AIDS Day, there will be opportunity for the counties to launch the county-specific HIV response, which will be able to tell them how they are doing as a county. So I think it will be a very good opportunity for every county to kind of appreciate the progress that they have made. Yes.
All right, I'm informed our time is out, but you didn't highlight to us some of the challenges that perhaps we still need to look out for as we focus on trying to bring the HIV levels down. Issues that you identified in your report.
Thank you. One, I think that number one is that still the uptake of testing is not where we would want it to be. So one area that we're encouraging is that all of us, we need to know our HIV status.
Yes.
And that can be done through testing. Number two, I'm looking at the young people. We need to continue empowering them with formal education and also HIV-related kind of information. Because when you look at comprehensive knowledge level is low. It is possible for a mother to conceive, go through pregnancy, and give birth to a child who is HIV negative.
Yes.
And therefore, what we are requesting is really mothers to come out to the health facility where they work with healthcare providers until delivery and even after delivery. Of course, this will be able to help us reduce the mother-to-child transmission.
Yes.
The other thing that we need to do is to all of us rise against sexual and gender-based violence. Also, it is not doing us well. There are also cultural practices that we know have not been really helping us when it comes to HIV, like early marriages, FGM. I think we need to address them. And finally, stigma. Let us all stand against stigma so that people can be able to come out and really protect themselves so that they can be able to take treatment and be consistent in it. Thank you.
All right. Thank you very much, Joshua. Unfortunately, our time is up, but we appreciate you giving us some of the insights contained in this particular report and what we really need to do if we are to talk about an HIV-free generation.
Thank you so much.
Well, that is Joshua Gitonga, the head for monitoring and evaluation at the National AIDS Control Council, just giving us insights that are contained in the Kenya AIDS Response Progress Report of 2018, indicating that HIV/AIDS new infections have gone down, but a lot more needs to be done. That is where we end your health segment, but business news is up next.